Diseases of excessive food intake, cardiovascular diseases. The objectives: recognize that diseases of excessive food intake affect people in rich countries. Point out that a cardiovascular disease is essentially due to slowing of blood flow in an artery and that the cause of this slowing is atherosclerosis. Notice that a great correlation exists between the concentration of cholesterol in blood and mortality by cardiovascular diseases. Specify that cardiovascular diseases have multiple causes. Do you remember this concept map? Look here. Overnutrition, we are here. Causes diseases of excessive food intake. In this video, we are interested in cardiovascular diseases. Let us start. In rich countries, according to the World Population Review, the evolution of food habits is expressed notably as excessive consumption of animal fat, meat, and sugar causing the diseases of excessive food intake. The food diet, which is rich in cholesterol such as eggs, some meats, dairy products, and oil, leads to or causes cardiovascular diseases. To prove that, look at this line graph. Look, the levels of cholesterol in blood increases when we have an increasing intake of animal fats in food. And when the cholesterol levels in blood increases, the frequency of coronary diseases increases also. Look here. When the cholesterol level in blood was below 150 mg per deciliter, the frequency of coronary diseases in the population was about 3.7%. As the cholesterol levels in blood increases to become higher than 250 mg per deciliter, the frequency of coronary diseases increases to reach approximately 6.5%. Atherosclerosis. When you talk about cardiovascular diseases, you have to talk about atherosclerosis. Why? Because this disease causes the narrowing of the coronary arteries, which might cause heart failure. The coronary arteries are the ones that nourish the heart. Okay. To understand more and more how atherosclerosis takes place, let us start with the first factor, increase of the level of triglyceride and cholesterol in the blood, formation of a deposit on the walls of the coronary arteries, formation of a plaque called atheroma. If 75% of the obstruction occurs, the blood flow to the heart decreases, leading to a myocardial infarction. Note, if the artery clogged nourishes the brain, in this case we will have paralysis. Can our body produce cholesterol? In fact, yes. 2/3 of the cholesterol found in the blood is synthesized in the liver. Is cholesterol important for our body? Also yes. Cholesterol is one of the constituents of cell membranes. It is also a precursor of sexual hormones, corticoids, vitamin D, and biliary salts. So, we have good cholesterol and bad cholesterol. In which forms does cholesterol exist in our body? Let us discover. Cholesterol is insoluble in plasma. It has to bind to a huge protein molecule forming complex called lipoprotein. Two types of lipoproteins exist according to their density, LDL and HDL. LDL, high density lipoprotein, which contains 13% of cholesterol. It's called bad cholesterol. It provides the cholesterol to the cells. Under abnormal conditions, LDL deposits cholesterol on the internal walls of arteries, causing the formation of atheroma. That's why it's said to be bad cholesterol. While HDL, low-density lipoprotein, which contains 55% of cholesterol, it's called good cholesterol. It plays a protective role. How? It carries cholesterol from tissues to the liver to prevent its accumulation in the blood. Relation between good and bad cholesterol and cardiovascular diseases. Look at this table here. Compare the amount of LDL in the normal individual and that in an individual having high risk of cardiovascular diseases. What do you notice? The amount of LDL in the normal individual is below 130, which is a value less than that in an individual having high risk of cardiovascular diseases, where the amount of LDL is higher than 159 milligram per deciliter. What about the HDL? The amount of HDL in the normal individual, which is above 40 milligram per deciliter, is higher than that found in an individual having high risk of cardiovascular diseases, where it's below 40 milligram per deciliter. So what conclusion can be drawn? The more the HDL is high and the LDL is low, the more the risk of cardiovascular diseases is low. And the more the LDL is high and the HDL is low, the more the risk of cardiovascular diseases is high. What is the relation between the risk factors and the coronary morbidity? Look here, miss. What are the risk factors that are related to our lifestyle? Diabetes, sedentary life, stress, HDL low, heredity, tobacco, obesity, age. All these factors may cause or may lead to cardiovascular diseases. What if we have more than one factor that exists at the same time? If we just have one risk factor from the ones that we listed before, we will have a risk. The index of coronary morbidity will be about 120. When the number of risk factors increase, the index of coronary morbidity increases too.